Doctor, you were still explaining the other causes of infertility, and you were at the point of diet and obesity.
Diet and obesity, which is very important in the Western world because of, obvious reasons. Then I told you about the hormonal causes of infertility. Anything that affects that hypothalamus pituitary axis can also cause infertility. Yes, like thyroid disease, tumors that can affect the axis will also affect fertility. Then chronic disease conditions, diabetes mellitus, hypertension, cystic fibrosis, okay? All those are reasons that men can become infertile. We also have what we call varicose veins. Those are enlarged veins, okay? They will also cause infertility. Then chromosomal disorders, okay? Now, here is where I want everyone to listen very well. They are what we call heat radiation that you are going to affect your testicles. I know we are going into steam bath and hot tubs and saunas. We are wearing tight clothing. We are carrying what we see as laptops, okay? Anything that is going to cause heat around your testicles can cause infertility. Yes. You find the sperms were there originally, but finally you have killed them, because when we were created, these tests are supposed to be hanging outside our body. Okay. That's why you realize that sometimes when it is cold, they become they extend out, and when it is hot, okay, they coil up. Okay. Or either way. So God was very smart when he was creating us. Our bodies are at a temperature of about 37 degrees, and these tests are supposed to live in a temperature of 25 outside the body. So anything that can affect them in terms of temperature can cause infertility in men. Then the scrotum, or if you have trauma, you are in Kampala, you're riding on borders, you have an accident, God forbid, something affects your testicles, that one can cause you to be fertile. Low hormone level.
Using the point of steam, sauna, and the hot tubs, and actually I wanted you to throw more emphasis, because today men find saunas and hot tubs as a fancy thing. Can you throw more light on that?
Yes, I told you that when we are being created, our bodies, the testicles, are supposed to be hanging outside the body. Mainly, they work on what you may think as a thermostat. You know, you have all used flat irons. Okay?
Yes.
When the iron is too hot, it switches itself off. Okay? And when it gets cold, it heats up again. So in the same way, these testes, okay, they are located outside the body. Yes, to regulate their location based on the temperature of the body. To start with, the body is at 37 degrees. Okay, I'm talking about in terms of centigrade in Uganda. Okay, I don't know what that is in Fahrenheit in the United States. Yes, so I was telling you that even the quality of our underwears that we wear are also a factor in that heat catalog. Okay.
Yes.
Yes. We use bikers, which are very tight on our bodies. Okay. And also nylon underwears. They are also trap a lot of heat on the body, and that will also kill the sperms eventually. Okay. Then I spoke about laptops. Okay. The laptops we are using will generate heat. If you put that, the way it is called a laptop, you put it on the lap, you'll feel heat when you are using it. Okay. So that one can also affect our sperms per se. Okay. Then surgery. People who have had vasectomy, of course, that is permanent sterility in men, they will not be able to produce. Then the biggest problem, especially as we advance in age, is erectile dysfunction. Okay, because you know that it's after erection that the sperms are able to be deposited inside the vagina canal before they can move all the way up to where the egg is. Okay, so it is more like you have been seeing the war between Israel and maybe Iran or whichever country has been fighting, Palestine or Hamas. They launch missiles, but the missiles have a propelling power that launches them. Okay, that propels them. Okay, so if you are not able to launch the sperms to be able to enter through the vagina canal, through the cervix, through the uterus, through the fallopian tubes, up to where the eggs are, the mature eggs, which you are during ovulation, then you are not able to produce. That is common sense. Okay. So that is also, those are all reasons that can cause infertility in men. Okay. Yes, then steroids. The use of steroids can also affect your sperms grossly. Yes. I believe we are still together now.
You've talked about a lot of things, but while the internet was disturbing you, there is a point that I wanted you to stress. That is sauna and steam bath in men in Kampala, especially those that have gotten some money. Almost every evening, a group of rich people always go to some saunas and they keep burning their testicles. I call it burning your testicles. Doctor, I want you to re-echo the emphasis on steam bath and its cause to as a cause of infertility in men.
Going to increase their temperature in the scrotum, they definitely die. You'll
Yes.
find that people come to do lab tests and you find what we call necrospermia. Necro meaning dead body, necrotic. Yeah. You find necrospermic men coming simply because they have denatured the environment where these sperms live in the testicles. Yeah, I say heat from sauna, from steam bath, from laptop, from very tight underwears, okay, from bikers, people who wear bikers when they are going to do biking, okay.
Yes.
All those things affect the temperature of the scrotum and they can cause sperms to die, okay. So
Okay.
it is very, very important that you don't, yeah, I know people are encouraged now that you go and lose fat and you go and lose weight by using those methods, but I can tell you from a reproductive perspective, they are killing their own sperms. Yes.
Doctor, let's talk about
Yes, sir.
let's at what point should a couple consider
Mm,
medical evaluation if they are struggling to conceive?
mm.
At what point?
Yeah. From the point of the definition, I told you, if you have been together and you are not family planning for a year, yeah, you should start going to seek help. There are many tests, or there are more tests that women do than men. For a man, what you are going to do, the first basic test for fertility is sperm analysis, okay, or semen analysis, okay. There are also people that don't produce sperms at all, okay. You might have semen that comes. I think your viewers or listeners can differentiate the difference, that there's a difference between the semen we see with our eyes and the sperms that the microscope sees, okay.
Yes.
So you might have semen flowing but does not have sperms, okay. And that can be totally a dry semen that what we call as spermic, okay, that has no single living sperm in it. Or it can have few sperms, which we call oligospermic, okay. That one is also there. You can have sperms that cannot move, with poor motility, which we call astenospermic, okay. We can have sperms that have poor morphology, okay,
Yes.
which they are poorly shaped, yes, which we call teratospermic, okay. So the biggest cause of infertility in men in scientific description is a combination of the three parameters. That is the low sperm count, the poor motility, and then the poor morphology, which is a long word called oligostenosyl
Wow.
So that is
So
the biggest cause of infertility in men in terms of investigation. Yes.
so
Yes, sir.
is infertility
Okay.
in men always
Yes.
permanent, or some cases can be treated?
There are cases that are reversible and there are cases that are irreversible. And where they are irreversible, it is very painful to say, but we always because of the interruptions we had. I had a lot to discuss. But where we find that a man's infertility cannot be treated, yeah, that is after we have tried to do a semen analysis, we got no sperm, we do what we call a testicular sperm extraction, which is briefly known as TESE, where we cut like a centimeter on your testicle. And then we go right deep into what we call the seminiferous tubules, and we pull them out because that's where the source of the sperms come from. We put them in the microscope and we find if there are sperms there. If a person had what we call OA, obstructive azoospermia, that may be, it is just the ducts where the sperms move from that are blocked, but the sperms are there. So there we can help a person to recover some sperms from the source, from the seminiferous tubules. But if we find that even there, where they are produced, they are not there, we advise the patient to do what? To be able to get donor sperms, okay? To make sure that is if the wife, okay, the spouse has no issues, to make sure that they can have a child. Because the bigger thing is to have a child. And once this child is born, it is yours. It will never know any other father. It is just in your mind that this child is mine, but it doesn't have my DNA. Yeah, but donor sperms are available, donor eggs are available. So that is in an irreversible situation. But in terms of improving the count, improving the motility, those ones have treatment. We always give people treatment, and then that can be reversed, sir.
before I leave that point of donor eggs, I've so many times been.
Sperms are donated, but you may not get as much as a sperm donor than an egg donor. Eggs, sperms are produced in millions.
Doctor, uh,
Yes.
take me through.
Mm,
If a couple is having
mm,
fertility issues, how do we normally approach
mm.
these men to the point of finding out their diagnosis? What do we do? What do we do at the fertility clinic?
Mm. Okay. Before any intervention is done, we have to do investigations. Okay.
Mm. Yes.
I'll be lying to you that if you came to a clinic and I just gave you medicine and say, okay, you go and produce without knowing what the source of the infertility is, it will not be helpful to you. And you definitely come to me after 6 months, after 1 year, and say, yes, what you gave me did not work. But we do investigations, especially from the lady. You are going to check her hormones, okay, to make sure that they are okay. Okay. Uh, this we do on the second or the third day of her menstrual period. Okay. During her menstrual period, when she's menstruating, we take her hormonal levels. Then from there, we also check your uterus. Okay. Uterus can have fibroids, uterus can have adhesions, especially women who have had serial miscarriages or abortions. What you say that someone has lost pregnancy, and then they take them for cleansing. That one causes scars in the uterus, which it's more like a spider web of tissue that develops inside the uterus. And once the uterus is occupied, it's like someone having a structure in your plot of land. It cannot be used. Okay. So they have what they call polyps inside the uterus. They will not also allow the baby to implant. Okay. And then we also check the fallopian tubes. Okay. If they are patent, eh? If they can allow the sperm and the egg to meet. If a road is blocked by traffic, definitely you will not be able to reach where you're going. So we have to make sure that the tubes are also investigated. Okay. Tubal blockage causes almost 60% of the infertility in women. Okay. We check her eggs if they are there, because at some point they cease being available. Yeah. So if we do a scan, we can see. Okay. There's a hormone we can do to check ovarian reserve, which is anti-Mullerian hormone, but a scan to me shows better results than checking hormones for eggs. Then with the men, since we are dealing with men infertility today, we check the sperms. Then from there, that's when we decide the type of treatment we give. Yes.
Doctor, let us throw some more light on the
Yes.
men. How do you collect these sperms? Because that's what is
Mm,
causing a scare among so many
mm,
men. I
mm,
remember when I was in Mulago, some men would come
mm,
to me, and each time you refer them to the lab to collect their sperms, they
mm,
always had a mixture of feelings of
mm,
what exactly. How do you collect off the sperm?
mm. The recommended method of collection from World Health Organization is by masturbation. You know, you can have personal feelings about it. You can have your today is a Sunday. You can have your spiritual feelings about it, but that is what we encourage men to give us the best quality of sperms. Because if we tell you to have coitus with your spouse, chances are high that during that excitement of uh, of orgasm, there is a chance that you might lose them while you are collecting them, or they can come contaminated with fluid from what? From your partner. So we always get a good clean sample of sperm by masturbation, and that is the method that is commonly used. Yes. Apart from what I told you, that a person who has obstructive vesselspermia, we must have to go there and cut the testicle and pick the sperms from there. Yes.
Wow. Again, I've seen places. That's why actually today on my program, I always bring the expert. There is a patient that I saw walking with a bottle of sperms all the way from Nansana, who was taking them to a certain clinic, not even a fertility clinic, but a certain clinic that doctor gave me this to go have the sperm in the morning and bring it to the clinic. Doctor, is that acceptable medically for me to go have the sperms at home and then bring them to the clinic?
Chances are high that those sperms will be contaminated, and they are supposed to be tested within 30 minutes after collection.
Wow. Wow.
That sample was not at body temperature. Yeah, we always tell people who can get accommodation very close to the facility that when you are carrying the sample, you put it under your armpits such that it's at the temperature of your body. It's not about picking it and then you put it in the dashboard of the car, and then by the time you want to get it from the dashboard, you feel that it is not going to be easy for someone to see you with it. By the time you reach the clinic or the lab with that sample, it would have liquefied most of the times. So it is not going to be useful. Yeah, and the sperms would have started. Of course, they get tired before they die. So you might end up with a sample whose motility is poor simply because of the environment it has been moved through. Yeah. So it is not advisable that you can carry a specimen bottle at home, not like urine or stool, and then you bring to the lab. It has to be done at the site or very close to the site, within a distance of less than 10 minutes to walk to the site. Yes.
Doctor, as we plan to wind up this discussion, in African societies, infertility is normally blamed on women. Why do you think male infertility still remains a hidden issue?
Of course, a man is a man in Africa. You talk about African society.
Yes.
So no man wants to be regarded as a woman. Yes. And you are supposed to look like you are in control of things. Actually, you are supposed to be in control of things, including fertility. So now, if a person is going to tell you that you are not able to produce, or that you are infertile for some reason, I think he's making you less of a man. Yes. So that is why we try as much as possible as men to say that I think that is not because of me. Okay. Just like parents will produce a child who has bad behavior, and then the woman will say, no, that is his father's behavior. Or the man will say that is from his mother's side or something. So we always want to frame our position in the family as the tower of the home, and you don't want to be put down. So that's why we always make an escape, even when we are the ones who are causing infertility, to push it to the women. But I've had many times couples come to me and I tell them that, you know what? The problem is it is your man who is trying to what? Who is not producing. But before we do that, definitely I'll call the man in secret and I give him the results. I say, you know what? This is where the problem is. It is both ways. Just like HIV results being released. If you decide and you say we are going to receive our results together, I'll put you together and you receive them. But if I find this is a man who first came by himself and tested, the next time he comes for the results, or if he is getting the results, I cannot involve his wife if he was not there, or his spouse. So is the woman, because most of the times that is where many relationship end up. Yeah, those people you are going to tell together, and you say your wife has a problem, she can't produce. The man will walk the other direction, and they meet at home, and then he starts their way of separation. Or is the woman also? If you tell him your man can't, and this is a woman who has been desperate to have child for long, she will not also be part of the problem she will not be enticed to be back in the relationship. And that's why you are having so many children these days being produced outside their relationships. And this DNA things coming up. When a woman has discovered that the man cannot produce, they will go out and have another man and have a child with. Okay. And before you know, you're going to have a child that is not yours. So that is where we are.
Doctor, I know you've in your practice there are so many myths and false information you've encountered about infertility. What are some of the myths that
Yes.
you've had from your patients about infertility, especially in male?
In male, we think that a man who is say muscular, well built, think about Golola or anyone else you know. Yeah, you
Yeah.
think that that man can produce and has good sperms. That is a myth.
Okay.
Okay, you can have someone as giant as Goliath in the Bible, but when they cannot produce, that is one. And then two, we think that when a man is old, they can't have sperms. They do have sperms. The oldest man produced today was 90 years old. Okay,
Wow.
produced by one of our hospitals in Zambia, and she produced a child at 90 years. So, and that is not typical for someone to think. So that one will say, no, that guy is already 70, he can't have a child. They will produce sperm which can fertilize. Yeah. In women, we always think that when a woman is getting her menstrual periods, she's still fertile. That is also a myth. Yes. You can have your menstrual periods up to the age of 50, 55, but when the eggs disappeared long time ago. So those are the two myths from both sides. Yes.
Okay. So again, maybe one other myth that I used to find in ultrasound room is men believing because I release olokuba mala. Then whichever once I see that white liquid, then the problem is with you. Not knowing, like you explained earlier, that some of you release free that has actually zero zero sperm in them on the microscope. So doctor, let's talk about a stigma. Let's talk about stigma and emotional support. This journey is not easy, doctor, in our society, especially as Black people are facing your family and you tell them, oh, I can't, or facing your wife and say, I can't, I really need to go to a fertility center for help or for medication. Doctor, how have you managed to navigate the issue of stigma and emotional support during these challenge journeys of fertility in men?
Yeah, fertility can be a very big psychological and mental problem. People run into depression. They are all called all sorts of names in society once they are known. And there's mental problem, right? Even when they start the treatment for fertility. Because by that time, a person is very expectant. and they think they are going to have that fails also, it can be troubling because the costs involved in it and the hopes that a person has really will have to disappear, and it's not very easy. And even after, yeah, of course, the person who has tried treatment and they get a child, yeah, the happiness is immense. They'll be overjoyed. But in terms of failure, I've seen a woman fail 3, 4 cycles. Some of them are in polygamous relationships, like women, and they are seeing that their counterparts, their co-wives, are having children. And for her, she has been to the hospital and failed. Yeah. So is men. But men usually they end up trying. You will see a man marrying one wife, second wife, third wife, they all don't have children. And they all leave and go and produce elsewhere. So it is so stigmatizing when a person is infertile. Yes, that it can even affect the way you perform at work. You see people coming to office, they are not themselves, but they are in their own world of thinking, how do I overcome this? They start hating to attend functions of you having baby showers, you're having deliveries, people going to celebrate with people who have had children. And some of them end up doing things that take their time. I heard about a woman who was doing all kinds of short courses online, to make sure that she's occupied. Yeah, not to deal with the depression. But finally, she ended up producing. So it can really have a very big mental toll on the person who is suffering and on relationships per se. Yes, you meet in the morning, you slept together in bed, you meet in the evening, but when you all have this running around your minds, it is very hard to focus, even to plan for any future together when you have a problem of infertility. So it is very devastating mentally.
Um,
Yes.
this show would really not be important if we talk about the causes and everything, and then we don't discuss the available options. Since I'm speaking to an expert from
Okay.
East Africa's biggest fertility
Yes.
center, Doctor, what
Yes.
are some of the modern
Uh,
treatment options available
mm,
for men with infertility today?
mm. Yeah. We start from the simplest, which we call TSI. That is timeless sexual intercourse. If your problem is not having the sperms, but the timing that you have been sleeping with your spouse, that one can be solved. You can be given the cycle, and then you know exactly when your wife is ovulating. They will give you a range of 5 days, 2 days before day 14 and 2 days after day 14, where you can just go in and make sure that he conceives in any of those days. Then, from timeless sexual intercourse, if the tubes of your wife are open, and maybe you have a poor sperm count or so, we do what we call a sperm wash, where we can concentrate those sperms and then they can be able to be put directly into your spouse to make sure that she can conceive. Yes. So that one is also what we call IUI, intrauterine insemination, or artificial insemination. The one you see, artificial fertilization, the one you see done in animals, where they can
Yes.
pick the sperms of a bull and just insert them into the cow. Yeah. So that's another method. Then the third method would be that you have to get the eggs and the sperms and put them in a dish together. Okay, this is when a baby is produced outside the body, which we commonly call IVF, in vitro fertilization. So that one can also work. You close out chances. Remember, we are looking for a single sperm like this to fertilize. So in IVF, that is possible, that you are going to get a single sperm at least to unite with this egg when they're in the same environment, out of the millions that are produced. But when things go really bad, we can pick a sperm and then inject it inside the egg, which we call ICSI, in intracytoplasmic sperm injection. And that is when extremely the person has a low count, has a very poor motility, and the morphology cannot be trusted. Okay, we do not go into abnormalities of sperm structures because that's almost a different presentation altogether. But you'll find that there are many sperms that are structured in a way that they cannot achieve fertilization. So in such a way, you go through the microscope and you pick one whose structure is good. Okay. The other thing I also didn't talk about, because of the interruptions we have had, is that the sperms that are bad are also causing miscarriages in women at a very high rate. And you will never get to know this. Okay. They have poor penetration, they have DNA fragmentation. Okay. They may have what we call aneuploidy. Okay, whereby you get into the embryo and all the zygote that has been fertilized, and you find that there is either a missing chromosome or is a double chromosome. Okay, and we have what we call trisomy. Okay, you have nucleosome, you have monosomy, we have trisomy and tetrasomy. So those are all aneuploidal conditions that can cause a sperm not work very well. And then we have what we call molar pregnancies. Those can all be sourced from what? From the poor sperms.
But I'm quite happy that we've been patient and we've been able to discuss up to this level. Doctor, as we finish this discussion, let's talk about the cost. The cost of handling and management of these fertility issues in Uganda. Are fertility treatment becoming more accessible and affordable in Uganda compared to what it was about 10 years back? Because one of the issues I've always received are people complaining that this process can be very, very expensive. But also for some people who have the money, they say, even getting to right places to have these treatments done is also a challenge. Can we talk about accessibility and affordability?
Accessible, yes. Yes, access. There have been many facilities that have been opened up currently. Even in our National Referral Hospital, there is a women's hospital. There are clinics. I think there is one in Imbarara, a number of them in Kampala. The only difference is the success rate, okay, of what you are going to experience. You might want to save $1 here or $1 million here and put it somewhere else, but if you are not going to get the service that you need or the result that you need, it is very hard. You are going to part with the money. Yeah, currently when you go to Mulago, they are ranging between 16 to 15 millions, depending. But at Women's Hospital, right now we have what we call a low-cost IVF, which is going up to December 31st. So which is at 19 millions. But you see, if I asked you to give me 90 millions now, maybe you don't have it. And so is me. But fertility is not an emergency like cardiac arrest or respiratory failure. That if you don't intervene at this moment, the patient is going to die. It's a disease condition, but which can help you to plan yourself. Even if you say that, yes, give me an account, I'll be depositing money as I get it until next year, around the same time, you are free. You can do it. You understand? So it is quite costly because the governments, and it's not just here in Uganda. I worked in Namibia. People take loans from banks. They sell properties to have children. Okay, the governments do not prioritize in many low and middle income countries. They don't prioritize fertility treatment as a priority in the healthcare system. So that's why it is still expensive. And the people that are doing the services are almost importing most of the things they use from culture media to machines from other countries. There's nothing that is made locally. Not like maybe you think of ARVs that are now produced in Uganda. Yeah, fertility treatment, hormones, injections used, catheters, they are all imported and they are taxed highly. So that's what keeps their affordability to a high extent. Yeah.
As we finally plan to wrap up this
Mm.
wonderful conversation, Doctor, what can men do in their early
Yeah.
life to maintain a healthy fertility?
Mm. Good antioxidant diet of things like fruits and vegetable, regular exercising, okay, of the bodies. Yeah, exercise. I'm not talking about steam bath. Yeah, because someone will say, I'm going to exercise in the sauna. No, we talked
Yes.
against that. Yeah, regular exercise, okay, that can help your body to rejuvenate, can help you, okay, and go for a fertility checkup. You know, it will not cost you a lot. Instead of trying to think that I think things are okay. I have seen
Oh.
men as young as in their 20s who cannot produce, okay, by visiting a fertility facility to find if you are fertile or not. So those are basic things that men can do. Then for yes, stress, of course, by exercising, you get rid of some of the stress. Sleeping is also very important, okay? Yeah, for your body hygiene and health, okay? So they are really quite important in terms of having a fertile male person. Yes, you are very right. Yeah,
Okay.
the stress, of course, starts from the brain, and it covers the rest of it. It is extended to the rest of the body. So if your mind is stressed and you are not able to function very well, thinking about the loans, thinking about the pressure at work, thinking about someone taking your property, yes, that will also affect your fertility, right from the sperm count to the ability to erect as a man. Yes.
Doctor, can simple life changes like quitting smoking and eating better, stopping alcohol really cause a difference in fertility and the quality of sperms that one produces? Can simple activity like
Yes.
quitting smoking and stopping alcohol really improve one's quality of sperms?
Alcohol. They definitely do, and we talked about some of the risk factors. Yeah, alcohol, smoking, use of drugs, they are very bad for fertility. Yeah, in men.
Doctor, someone has sent in a question here saying, what about undescended tests in boys? Yes, please.
Hello?
Yes,
Yes. As we wind up.
Yes.
Yeah.
Undescended tests in men, can it cause fertility?
It can cause infertility. When we're examining men, we even look at the size of your testicles. Sometimes you find there's one missing, and sometimes one is very small compared to the other. Those are all signs that the sperm produced from such kind of testicles can have DNA fragmentation, or you might even fail to produce any sperm at all. Yes.
Okay. These are just questions from your viewers, Doctor. People are thanking you for this needed conversation, and they are saying they can't wait to have the second episode of this. Someone here is from Wakiso is asking, Doctor, can frequent use of phones and laptop affect the health of one's sperms? Just in one sentence, Doctor.
The laptops can. I don't have good evidence on the phones, but the laptops do. Because of the heat that is generated from the motor of that laptop.
Okay.
Yes.
Then this one is coming from Kauma. Kauma is in Canada and is asking, Doctor, at what age does male fertility begin to decline?
Yeah, fertility, we are talking about a package. And I told you that your levels of erections are not the same when you are a teenager and when you are to propel them to go into the fertility. So that is where part of the infertility can come from. You have the sperms, but the erection is not there to deposit them.
Okay.
So you start in your early 50s. Yes. The sperms will be there, but the erection is missing. Yeah.
This is funny from Martin in Dubai saying, Doctor, is infertility hereditary among men?
Many conditions can be associated to our genetics. Talk about diabetes, talk about hypertension, talk about cancer. So you have seen families where the man has a series of children, 20 or 30 of them. And you have seen other families from their grandparents having 2, 3 children. And even when they want to have more, they have very few. So those families are also there. Not because of family planning. So that is an area that has not been well researched, but trust me, that it can be inherited. Yeah. We do not talk about another factor called pre-genetic implantation diagnosis, where we take off samples and we can decide to say this child is going to be male and this one is going to be female. People can also have those problems that they are producing a series of girls and a series of boys. Okay. So in that kind of order, we can also think that, yes, hereditary, you can have infertility in the families, that one family does not produce that amount of sperms that is sufficient for production, or that their fertility windows are very short in those families. So that one is also a factor.
Doctor, thank you so much for being here with us. I know it's been a struggle for us to finish this discussion, but it has been very important and impactful. Before you go, what advice would you love to share with couples and men that could be facing this problem of infertility? What is your advice for them?
I encourage people to try and find out what the cause of infertility is. Even if you are not going to afford to treat, at least you will know, yes, it is my problem that my wife is not producing for men. even women, you will know, instead of blaming your man that, yes, I think it is my fault. Yeah, some of us are born from polygamous families. If I tell you my story of how I was born, it was just a miracle. Yes, because my father had his first wife who could not produce, and then she brought her cousin sister who became my mother. Yeah, so infertility has been there for generations. You can decide as a couple and say, yes, we know we are not going to have a child, but let's adopt one. Okay, instead of spending all the money that you have buying herbs. Yes, I am a Christian, and I believe that it's a Sunday, people are going to church, spending nights in overnights of a miracle that is not going to happen.
Yeah. Wow.
As a couple.
Doctor, thank you so much for being with us today, and thank you so much for your time. We can't wait to host you next week as we discuss infertility on the women's side or the ladies' side. And to our viewers, we promise that we are going to make sure we have better connectivity, and
Better connectivity, yes.
we shall try to work to see how we can have an interrupted program. Again, I want to thank the management of your hospital for allowing you to give us this free knowledge, and also to speak to Ugandans and the world at large about a problem that so many people don't want to tackle. From everyone, Doctor, I wish you a very blessed Sunday. And anytime you can have within the week, please let me know such that we have a recording on the sperms, where we shall talk about the different causes of infertility that actually come from the sperms. I think so many men have questions there. So I'll let you go and wish you a blessed Sunday, Doctor.
Thank you very much. I'll do that recording from my workplace where there's good IT system.
One wants to talk about. These are kinds of discussions that we don't know. Men listening in today, from what doctor said, we are responsible for more than actually 45% of the issues that are disturbing our women. Things that I've picked out, number one, did you know that your quality of sperms could be the reason your wife is having multiple miscarriages? Did you know that as a man, men, we are responsible for 45% of all infertility cases in couples? Did you know that the women are only responsible for 35% of the causes of infertility? Did you know that 15% of the cause of infertility in couples is both of you have issues, and 15% up to now the doctors don't know the causes? So before we point fingers to our women, let us try to find out. To the couples out there that are battling to have a child, please seek medical advice. Right now, there is a campaign in Mulago to help women that want to have artificial fertilization at a reduced cost. Please go and find out the rightful information. And again, we continue to call upon all people that can afford to set up more facility centers in the country, in different regions of the country, but also to ask the government of Uganda to set up more fertility centers in all regional or government hospitals. Again, my name is Mr. Selfcare. Thank you so much for watching. Remember, the month of November, we are going to talk about fertility, pregnancy, and everything. Today, we started with infertility in men. On Thursday this week, on Thursday this week, we are going to handle sperms. Men with low sperm count, immature sperms, sperms with no tails, everything to do with sperms. We are going to look at that. We are going to look at its production, its transportation, and how it is able to, the problems that affect it, and how we are able to solve them. The next week, we are going to look at women. We are going to look at women infertility on Sunday, still with a representative from Women Hospital of Bukoto. And then the third week, we are going to start the journey of pregnancy. preparing for pregnancy. And here we are going to have Sister Banula from all day from Lubaga Hospital to discuss this topic. And we shall conclude the month by looking at postpartum depression, something that affects almost a big number of women after giving birth. Again, thank you so much for being here. Remember, infertility is not a verdict. It is just a condition that can be understood, treated, and overcome. Let's keep the conversation going. From me and everyone, my name is Mr. Selfcare. Have yourself a blessed day. Bye.